Hello, everybody. Welcome to this week's episode of Your Gray Matters. I'm Jason, along with your host, Neil. How you doing today, Dad?
I'm doing great. How are you?
I'm good, thanks.
How's
Uh,
the weather? How's the weather out in Edmonton?
so it's warmed up a little. It's minus 32 right now. So,
Oh my God, a reprieve.
yes, yes. Well, you go in the cold, you're gonna catch a cold eventually, and if when you get a cold, you need some medicine, and that ties in a little bit with what we're talking about today. I thought it was a fascinating interview that you've done with this person. Why don't you tell us a little bit about it?
Thanks very much. I'm really excited to have Aaron Sims on. Aaron is a young entrepreneur who's been building a great company that actually helps with the process of if you're seen as a patient, you go to your doctor, then you need to get medication. There's a lot of steps. Your pharmacist has to follow a lot of protocols. Guess what? This man's making it better. His
Yes.
systems have really been improving things.
Yes, he is. And he mentioned his start at the University of Windsor. That's my old stomping grounds as well. So I have fond memories of that place. So that was good to hear that he does as well. Everybody, please like and subscribe. You can do that by hitting the subscribe button, which is right below this video. Leave a comment if you would be so kind. Tell a friend. And anything else?
No, we are good. Let's go watch Aaron Sims. Hi, everybody. I'm Neil from Your Gray Matters, and welcome back. We're so glad to have you here. And whether you have gray hair or no hair or red hair, but come on, we know what's under there. We're glad to have you here. And today we have a fantastic young man. His name is Aaron Sims. He's an entrepreneur, and his company is providing products that help us every single day. Aaron, welcome to Your Gray Matters.
Thank you, Neil. It's a privilege and honor to be on the podcast with you. And I guess I have a little bit of gray hair myself, if I might say so. So, privileged to
Well,
be here.
Well, I'm glad, and I wish you many years of growing it. I
Thank
always
you.
tell people my vanity point is I don't care what color my hair is, I just want to have hair.
Right. Exactly.
So let
Yeah.
me tell you about Aaron Sims. Aaron graduated with a Bachelor of Commerce degree at the University of Windsor, and he spent many years working as a financial consultant at a CA firm in Toronto. But after many years of working there, he realized his true passion was for healthcare and the technical space and started a company called Pharma Security Group, PSG. Really good for a young man. During the first 3 years, the company focused on trying to solve a major issue plaguing healthcare networks across Canada and the US. That issue was the mismanagement of medication for patients, which costs the North American healthcare system more than, get this, $40 billion annually and results in thousands of preventable deaths. Think about that for a minute. Although his company attempted to solve this issue by creating simple and cost-effective solutions, which they marketed and shipped directly to patients and their caregivers, he realized that these issues were better addressed at the provider level, such as the pharmacy, and decided to pivot back in 2014, moving away from physical products that PSG provided to patients. Today, Pharma Security Group maintains multiple licenses with the Canadian Radio, Television to Telecommunications Commission. You know them as the CRTC. In order to provide communication systems that attempts to reduce the provider and patient medication errors while creating a more effective operation at the pharmacy. I know that I kind of stumbled on those words, Aaron, but let's put this in English, at least for me. What it seems like you've been doing is working on how the providers and the patients and everybody involved communicates. And you had to involve the CRTC in that. Tell us a
That's
bit
right.
about
I know it's always interesting and kind of scary when you hear the CRTC being involved in any of this work.
that.
Uh, I'll tell you, I'll preface this by saying that it was never my intention to tie in an organization like theirs. But it just so happened that given the tight restrictions and the compliance mechanisms that are in place, to ensure that there's a reduction on the spam that takes place with communicating with patients and providers. The CRTC offers an opportunity to obtain certain licenses on the reseller side, so that way we would have a much easier time being able to, offer our services directly to pharmacies and other healthcare groups. But that is a very interesting point you make there. But the CRTC and how are they involved in the entire mix here?
That's so,
But
so fascinating.
that's
Fascinating.
right.
I want to ask you, do you focus on developing products for patients, healthcare providers, or a combination of both? And what products have you come up with, Aaron?
So a lot of, and I'll just take you back a bit here. So when we first started, our goal was really to create some products that solved the medication mismanagement problem. Really, the issue that a lot of North Americans, and really it's a global issue. So people around the world, especially seniors, are faced with on a daily basis, which is making sure that people can take their medication on time and that they're taking the right medication.
Correct.
And so initially, I sort of set out with some business partners on the notion of trying to solve that issue in the home. And back in 2010 and 2011, somewhere in there, we created some, under $20 items that essentially any senior and anybody, really, whether it was the patient themselves or the caregiver, could make use of. And these items consisted of pill containers with built-in alarm reminder systems that you would find at your local, Rexall, IDA, Guardian Medicine Shop, so those types of pharmacies in Canada. And essentially, what we wanted to do was, help patients in a very cost-effective way be able to manage their medication. And we thought we were doing them, a big service by having a very simple product. What we didn't realize was that, first of all, there's a lot of education that goes on behind the scenes in that space. It's very difficult to tell somebody who's already used to blister packs, or they're already used to, their big pill containers that don't have an alarm system, that now they need this product. And without the educational component with the pharmacist involved or a physician, it's almost virtually impossible to get everybody on board and a pharmacist, pushing this product as well. And there's many reasons why that happens, especially in our healthcare space. And from a provider stance, there's a lot of funding that they have available to them for certain programs and products that they get to push, and our product just wasn't in that category at the time.
I hear you.
So understanding that we were really faced with an uphill battle in 2014, as you were saying, I actually did have to pivot, because from all the relationships that I had built with these pharmacists, I realized that the easier path of least resistance in this case would be to create some technology that patients could make use of, but would really benefit the order management process on the pharmacy side. And the order management process really was where everything began on the refill, the medication management side of things. So by being able to help solve a pharmacist in that area from I guess, that angle and plan of attack, we were able to then achieve many goals at the same time by being able to also address some of the needs on the patient side. And at least the patient wouldn't have to pay for it at all. It was all being paid for by the
Wow.
pharmacy. And that was the other part of the equation here that was causing us a lot of hardships initially.
Amazing.
So
I have to say, and those of you who follow the show know that I have an elderly mother who's living on her own. I have an elderly mother-in-law, very fine person who lives on her own, and they're in their 90s and they're at home alone. And so I imagine that there are some issues for seniors when they're trying to manage their meds, they're trying to remember what they took. I'm on meds, I'm diabetic. Luckily, I use one of your products actually, and I don't lose control of my pills. But maybe talk about some of these challenges that have happened.
For sure. So one of the big challenges that we had, so I'll start from a business standpoint, was being able to continuously engage with the patient who bought our product. So
Yeah.
in the case of the pill container product, we ended up on like we deployed a DRTV approach where we ended up on infomercials, and we were on the shopping network in Canada, the liquidation channel in the States, and we were trying to educate the market using that approach as
Uh-huh.
to why they needed our product. So you would have a patient purchase the product, but really being able to track who that patient is and find out a little bit more, even from a high level, where we understood our market and we understood who our buyers were, and be able to stay in touch with them, proved to be very difficult, especially when they were just buying, an under $20 item from us on TV or directly in the pharmacy. So it all came back to our relationships with the providers and specifically the pharmacists. And really, once we got in with some of the larger pharmacy groups, such as McKesson, that opened up a lot of distribution channels and a lot of opportunities within the Canadian market, specifically the IDA, Guardian Medicine Shop chains. And now we're at a point where we create the technologies that a lot of these pharmacists need, specifically on the medication management side, that could help not only their patients, but also help the providers keep track from an audit standpoint of, who's taking what, who's still, overdue for certain refills, who did refill their prescriptions. And then using our systems and our technologies, we're able to further engage with the patients. So, such as yourself, when you go to refill your medication, the pharmacist not only knows that you're calling in to refill your medication, but when you put through the refill requests, everything goes right into the system, gets fully documented, and
Wow.
that helps the pharmacy from an audit standpoint keep track of the orders that come in. In addition, they can then see if you don't pick up the medication or if you're past due for a refill, they can then start sounding the alarms. They can try to call you. Maybe they'll call a caregiver, especially if you're at a point where you should be remembering these things. And when I say you, I mean, obviously, a lot of seniors out there who do take quite a number of medications and have a hard time managing it, unlike
Yeah.
yourself, which thank goodness you're not in that same class. But, there are a lot of people out there who have difficulties and they just don't have the care infrastructure in place because they don't have family to call them all the time and remind them. So
Right.
really that's where we're trying to pick up the slack and help in that entire process of communicating effectively with patients and the pharmacies. So
And it's so smart, Aaron, because what you're doing is you're trying to make it as user friendly as possible for the providers, the pharmacies, and the patients. And as you said, some of these patients may not have good control of what they need to do every single day. Well, I certainly do congratulate you on that. And I have to admit, we all know the average pharmacy now is being allowed, I guess that's the right word, to do a lot more things than they used to do. So now you can go to your pharmacy and get a shot. That never
that's right.
happened before. So that's got to be all kinds of extra technology and paperwork and auditing and etc. And I remember I got my COVID shot at my pharmacy during COVID, and the gentleman, he's a wonderful guy, but he just didn't want to give it to me because it was COVID. So he'd make me
Right.
stare at the wall and put my arm out like this and then cover my mouth. And then
Yeah,
he'd give me the shot.
exactly.
My doctor never did that. But of course, it was easier actually to go to the pharmacy.
And the pharmacist really has like they carry a lot of weight. I'm not a pharmacist myself, but I can speak, for the ones that I know, at least I can speak very highly of their capabilities and their level of competence because they are really that last line of defense
Yeah.
when it comes to dispensing and making sure that they are on top of the orders. I was thinking about this earlier, and I thought, maybe one of the easiest ways to kind of describe the role where we fit in is on the order management side, but we're assisting the pharmacy with making sure that they don't make a mistake. when it comes to dispensing the right refill and the right medication. And, that really is mission critical for these pharmacies. It's not like providing some school supplies to somebody and making a mistake, and then, people come back into the store and say you made a mistake. Really, the pharmacist can't dispense the wrong drug, and they always spend extra amounts of time making sure that you don't have allergies and really cross-referencing things. So you're right, it is really important that they are on top of these different aspects of their business. But now with the expanded scopes of practice that the provincial government here, as well as other provinces, have engaged in, where they're allowing pharmacies to take on different roles, and they can actually almost prescribe and dispense certain types of medications for treating very basic ailments. So, and then apart from that, of course, they played a critical role in distributing the vaccines through COVID. And that really was, I think their big moment through, over the past few years here. So, it is very clear that the pharmacy is that community hub and the place that we all rely on. It's the most accessible, for a lot of things, even more so than your own physician. You'd have a much easier time walking into any store and picking up whatever you need and speaking to a healthcare professional such as a pharmacist or their techs, much easier than going to a doctor who you might have to wait weeks or months to get in and see. So,
and I have to say it is a very clever answer to this problem of so many people not being able to even find a doctor, let alone wait for an appointment. And appointments can take a long time. And to be honest with you, Aaron, I worry about the health and welfare of our medical workers, our doctors, our nurses, the support teams that are there. It's a big part of the challenges that we're having right now. And I've spoken to a lot of friends of mine who have medical students for kids. And those kids don't want to be GPs anymore. These kids want to be specialists. And it really is a changing environment medically, isn't it?
It really is. I was just watching, I believe it was Global News in Alberta, who had on one of the chief medical officers there, and she was discussing how a lot of doctors do not want to become GPs anymore for many reasons. Obviously, money is a major factor. A lot of these specialties are, maybe a little bit more attractive in that department, but at the same time, the work of a GP, very, very few professions go from cradle to grave the way a GP does, from the moment you're born all the way to the end. And it's very, very difficult to find, good quality GPs. And it's becoming very difficult just to find a GP anywhere, like across this country. And it's
well,
it's
there's a lot
really
of conversation, good points. There's a lot of conversation right now. We have a lot of immigrants coming into our country. And some of them in their original country are licensed physicians. They're medical people. And it takes a long time to get licensed in Canada. It can be very hard on them, I understand. I think that there are changes afoot to make it a bit easier, to make the qualification easier. That would help part of the problem for us with the lack of medically efficient people. But
right.
someone else has been talking about, yeah, but if they come to the country and they are doctors, can't some of them have to agree to go to places that most people don't want to go to, but at least they're in the country? And I don't know if that's an inappropriate statement, but it seems to me that if we can get such wonderful qualified people who come here from other countries and we can send them to places that doctors don't normally go, it's a great service for everybody, including the doctor. Would you agree with that?
Right. Right. I think that, there's so many communities out there that are in need. It's funny, actually, you say that, because it's a great point. My friends who live in Windsor and in London and in other smaller cities across the country, even out west in the prairies, they have a much easier time in some cases getting a certain specialist or a certain doctor than we do in, let's say, Toronto. But at the same time, I definitely agree that there are smaller communities like the Sioux Lookouts and Canoras and smaller rural, communities in Ontario, across the board, really, that do not have, access to MDs and not just that, dentists too, and many different healthcare professionals and there's many reasons for that. I know that there's some good services coming online, these days. In the past few years, especially with the pandemic, virtual care has become, something that seems to be
Huge.
more of a mainstay. And in Ontario, there was, initially, I think we were very open to adopting virtual care, and there was a big push. And then there was a bit of a cutback with the funding that was available for doctors offering
Mhm.
virtual care. I believe that's changed back, or there's been some changes to that recently. But, I think that the future really is going to your pharmacy, sitting down and seeing a doctor, virtually or otherwise, putting on the blood pressure cuff, doing a lot of the work right in the pharmacy, and then walking 10 steps over to the pharmacist, who then hands you your medication,
Yeah.
and then maybe looks at you just one last time, then signs off, and that's it. And then you go home. Maybe beyond that, it would be a full delivery model would be the actual future, to like replacing, a physical store. But I don't think that people don't want to go to either a doctor's office or a pharmacy. It's just sort of like people would rather go to one or the other, because the last thing you want to do when you're not feeling well is run around to, many different places, to a walk-in clinic, and then to try to find a pharmacy that's open, and then wait
Yeah.
around a half hour. It's like the last place anyone wants to be. And when you just need refills, everything should be pretty, automated
Exactly.
and clockworks.
Well, we've become used to one-stop shopping in so many other areas. I mean, if you go to your local grocery store, you're going to buy your groceries and your pharmacy products. They're
That's
there,
right.
and they're
That's
qualified
right.
pharmacists. It's also very interesting because I knew of someone who has a group benefits plan, and he was having some very, very serious challenges with his medications, and it was causing some real terrible challenges for him. And the group benefits people weren't able to get him a psychiatrist. That's what he needed physically, but they got him a virtual one within a day or two. And
There you
I
go.
always say that we live in amazing times because the virtual psychiatrist made the decisions, got the info to the pharmacy, and he picked it up,
Right.
and it made a difference. Can I ask you, there are products I think that you're implementing for seniors, and I'm just wondering what some of them are and how they're designed to help seniors.
Sure. So following along from, after 2014, when we got more involved with pharmacies, a lot of the work that we do is more on the phone and text messaging communication platform side. So what happens is a pharmacist, when they need to notify you that your refill's ready, or they just want to let you know to come into the pharmacy for whatever the reason is, they can send you a text, they can call you, and a lot of this is actually automated. So we've created more of like a streamlined approach. And then depending on how you respond, if you don't respond, there are other options for follow-up where the pharmacy can then get in touch with a loved one, or a caregiver that they have on
Sure.
file. So it really helps with people who want to stay independent longer. And, based upon like what you were saying too, with people who are aging, and seniors who are, everyone's living longer. So you said that your mother and your mother-in-law, that they're doing their thing, and they want to probably stay independent as long as they can.
Oh, yeah.
And as we age, and as everyone is, entering a time where people are living much longer than they
Oh, yes.
previously did, and everyone's just trying to figure out the system and navigate this. It's all new territory for a lot of people. So, really creating technology that makes sense for people who have smartphones. I would imagine that in 10, 15, 20 years, you're going to probably still be holding onto a smartphone or something, whatever
Sure.
comes out,
Sure.
and as will I, and everyone else that I know. And so, your ability to be able to respond to a text or answer the, a call that comes in shouldn't diminish. It should be there. And, if anything, if you're
Sure.
always doing that every day, it'll, keep everyone stimulated and on top of being able to manage things like, remembering to take their medication or pick up a refill. And so a lot of the systems that we've created, some are more inbound focused for the pharmacist, like on the refill side, but others are outbound, which allow, pure engagement with their patient base. And it'll just be interesting to see how more and more people respond to technologies like this as time goes on, and there's more apps that come out, and there's more, education surrounding the use of technology to help with managing, your daily activities, and part of that being taking medication. So really that's about it in terms of where we come in. But a lot of the products that we created back in the day, like yourself, you still make use of, and pill containers with alarm systems,
Yeah.
like those, I don't think that pill containers and certain physical products will ever go away. There's always going to be some need for them. But I think just how we use those products in conjunction with technology is really where we come in, and we're trying to figure out and really learn as we go the best approach here for based on what patients want. And I could say confidently, as of today, we've built up a nice following, and we have a very strong refill network within our platform across the country, where a lot of pharmacists rely on our platform, both on the web and by phone, for their patients to be able to refill their medication. And then they receive, all the information and feedback from that.
It's fantastic what you're saying for a couple of reasons, Aaron. First of all, my mom lives on her iPad. So the idea that seniors aren't online isn't true. We're all online. I'm doing a podcast. I'm almost 70. The interesting thing, though, is the technology that you're discussing is really growing at a pace to not only meet the needs of every age, but actually lead in many ways so that people aren't stumped. This whole podcast that we do, Aaron, the motivating theme of it is actually that the human mind cannot be defeated. I totally believe that we will always find a way, and you're perfect proof of it, and your services are proof of it. And frankly, what the pharmacists are able to do now, and the miracles that our doctors pull off for us, I mean, it's easy to feel down sometimes in the situation, the world that we seem to be in. I find it mesmerizing. I find it amazing what we're able to do. And I think the young guys like you are going to keep it going. And if you don't mind, I'd like to talk to you about being an entrepreneur.
For sure. And maybe just before we touch up on that,
Go
I had
ahead.
a quick question for you while we're on that topic. So,
Sure.
with a mother who, she's independent and she's on her tablet, and as are you. So do you find that, they're more willing to embrace technology because it's in front of them and because they have kids who are willing to show them? Or do you find that, especially from a medication standpoint, like this is an area that interests me, because we've been trying to fix this somewhat disjointed, broken healthcare system here by creating effective communication between providers and patients. And from your standpoint, being I'm not sure your role in terms of your mother's health, but like, do you find that certain pieces of technology help her manage things? Or, and it may not be specifically medication, but just in general.
Sure. So my mother and my mother-in-law actually too are very much into technology. I'll speak about my mother who's 91. She lives on her iPad. We're playing word games all day long. She's emailing. And then I get called because the stupid thing's not working. Well, the stupid thing works fine, but she's learning how to do it. But the ordering of medications, I don't know how that will happen. And this might sound funny, but it might be as simple as one's eyesight not being able to order it properly. So I don't know yet if we're sophisticated enough to email in your prescription needs. I think it'll come, and maybe it happens already, but there are natural aging processes that might reduce the ability of people to do that. But in general, I wish that all of us could just go online, not sit on the phone for 10 minutes while the pharmacist gets to us. No disrespect to the pharmacist, people have needs. Wouldn't it be nice to be able to just launch onto your phone or your iPad and just order your stuff?
That's absolutely it. Like, and that's really, I think, more of a testament to, maybe even the situation that your mom's in, the position that she's in. Thank goodness, it sounds like she's independent and able to, just figure it out also, and hopefully she's not needing to run to the pharmacy often, and
Yeah,
that's why, you know, especially with from my standpoint, a lot of the technology that's created really has that angle in mind where we're trying to figure out like what's the easiest way and the path of least resistance for a patient who just needs to refill, you know, and
exactly.
trust that their pharmacist looks after them from start to finish. You know, how can they use their phone to be able to, you know, get the refills done faster? And they shouldn't be the, you know, definitely they shouldn't be sitting on hold for a long period of time in order to do that. So that's where we come in and we try to automate that whole process. So
Well, ease of use is what we all expect nowadays and we need. And as we get older, we for sure need it. I think it's funny when my pharmacy, and I love my pharmacy, but I think it's funny when they call me and say, you don't have any repeats. Can I get you more? It's like, no,
right.
I don't want any more. I'm off the meds. But
Right,
we live
exactly.
in such a crazy world where people are so apt to sue somebody else. I guess that they have to ask us. But I love the idea that your technology can just take care of this.
Hopefully, like that's the goal, right? Like we're trying to help, but we're also trying to understand our market all the time because it's always changing, and the pharmacists don't always have a good handle on that aspect because they're focused on what they do best. And so like that kind of leaves it open for us to understand the patient approach, you know, and creating technology or systems that just make it a little bit easier for everyone
Yes.
to be able to manage, you know,
Well, I gotta,
their
I,
medication.
I have to congratulate you because you know what, you're thinking ahead and you've seen, you've seen a need and you're fulfilling the need and good for you and good for your team. And I have to thank you as a gray-haired guy.
Appreciate
Thank
it.
you for everything that you do. And I'm also very impressed with the fact that you're a young entrepreneur. And you know, we hear a lot today about people, they come out of school, they spend a lot of money at university, they have debt through their roofs, and they can't find a job. And I think this is just a personal opinion. Having had a job for many years, but I became an entrepreneur in the mid 90s, and I just couldn't imagine now having a job, even though I have zero bad thing to say about having a job. I think it's wonderful. But what's your feeling about the need for more entrepreneurs, or will younger people just be forced into that role of having to become an entrepreneur? Tell us what you think.
Well, I think that really it all starts with the mindset, right? Of people coming out of school or young and old. It doesn't need to be, there's no time or right place to become an entrepreneur. Anyone can, you know, figure out a good idea and, you know, also find a good market, but the right time helps to play, you know, a crucial role in their success. So if the timing is right, the product is right, and the attitude is right, really, I think you need all three things lined up in order to be successful. You
Right.
know, but with that being said, people coming out of school, you know, who are having a hard time finding a job, if they, you know, enjoy a challenge or just enjoy, you know, helping people, you know, get by or improving the quality of someone's life, you know, whatever that looks like or means in terms of, you know, what they're able to offer, they can problem solve with their friends, they can sit down with, you know, different leaders in the community or really anybody who they've looked up to and ask them, you know, just what they think a good product fit might be, and then they can try to take that product, you know, and demo it to a select group of people, you know, free of charge. It shouldn't cost anything besides maybe the prototype, to just try to figure out, you know, if there's an actual fit here, if people would be willing to buy that product. And, you know, before approaching, you know, either family, friends, or these incubators that are set up all across the country, like in every community, there seems to be incubators popping up, and they're very happy to offer funding, you know, to the tune of several $1,000s at times
Wow.
to help entrepreneurs, young and old, you know, get started, connect them up with lawyers and accountants. My mind is so focused on doctors. I was going to say a doctor too, but I guess in that case, it's almost easier to get connected up with, you know, a lawyer and accountant these days than maybe a doctor in Canada. But, with that being said, there's great resources out there. And that's essentially how I also got started, was out of university, working for a consulting group. But, I went back to the university that I used to go to, and they had great contacts and resources for me to reach out to and really help get the ball rolling. This is a long time ago, but I'm sure not a lot has changed. And it's good to make use of people who are in the know, because they seem to have a lot of good contacts and connections. It's all comes down to networking. So
Yeah.
from there, once you have the right product or something that feels right and seems right, then you can protect it, get some funding behind you, and you're off to the races, and you could start selling it. But
Well,
it takes time for sure. It's definitely a process, and it's very hard to be an entrepreneur, at least these days, by yourself. It usually still takes a village to build something and to create something meaningful. But that can take on many forms too. And in my case, it's just speaking to pharmacies, and finding out what they like.
you've done a fantastic job, and you're having an impact on society already at a young age. Your processes, your products, good for you. Congratulations, Aaron. I mean, really, you're a star in your own right. And I'm loving entrepreneurs, and I see so many young ones nowadays. I meet a lot of them in the real estate world, and they come up with new ideas, and they fight through the challenges, and they lead the way. And eventually, many of you will actually start bigger companies, and you'll be able to give jobs to people. Not everybody's an entrepreneur, but it's one of the beauties of living in this country. So, Aaron, I have to thank you for coming on, but I want to ask you, if people want to take advantage of your products, where do they go? What should they do?
Sure. So we have a website. It's pharmasecurity.com. The website, it's really set up more for businesses. So because we do a lot of B2B work,
Yep.
as opposed to business to consumer. But, if people are interested and maybe they have a pharmacist that could benefit from our products, and therefore directly, whoever is interested in our products and making their lives a little bit easier when they're calling in a prescription refill and not have to wait on hold for a long period of time, and they want to let their pharmacy know about our products, that's definitely something that can be done. If they reach out to us or want to speak to their pharmacist and let them know to visit our website. We are set up here in Canada, and we have a team willing and ready to help out with any pharmacy that does not have existing technology such as the technology that we offer. So
Well,
I really appreciate. I also just want to add, I really appreciate being on the podcast and everything that you've done for the community too. I've been a big fan of yours. I've watched all your different podcasts, and you've also brought on a lot of amazing, brilliant people, and definitely entrepreneurial as well. And as is yourself. So I want to give a shout out back to you, and really appreciate everything that you've done for entrepreneurs and for people young and old in this country, and as your podcast grows, I'm sure around the world. So
well, thank you for that, Aaron. I'm very moved by your words. So we'll grow our companies together, and as I get older, you'll just make sure that I have pills. And
perfect.
gentlemen, thank you very much. We will post Aaron's information for you. It'll be in the description. And just know that there are young people like Aaron out there working hard to make our lives better, make our planet better. As I always say, the human mind cannot be defeated. We will find the way to make things better. I promise you that we'll be back next Monday. Thanks very much for tuning in. Aaron, again, bless your heart. Thank you. And goodbye, everybody.
Thank you,
Have
Neil.
a great week. Take care.